Hi, I'm Matt Corriere. I'm a vascular surgeon on the faculty at the University of Michigan, recently relocated here from Wake Forest University. I was a Wiley Scholar in 2014, and my application and proposal related to that award from Vascular Cures involved applying elicited patient preferences to shared treatment decisions for PAD. And basically that project used a discrete choice survey iPad app to clarify and quantify patient values so that they might be applied to a shared treatment choice for a patient with symptomatic PAD. I think because that project was very patient-centered and also involved mobile technology, I was approached by Vascular Cures about getting involved with Project Voice, an idea of theirs to develop a mobile health platform and digital platform for patients with PAD to track their own treatment outcomes, report their outcomes, and communicate with providers. That was a really interesting idea, and of course agreed to participate. And that was in the spring, I suppose, of 2015. Over the initial few months after we got started, we convened a medical advisory board, had a few conference calls, and actually pretty rapidly developed a prototype. My interaction with Vascular Cures related to the process was one of an advisor and someone who could frame clinical questions, but their organization did much of the legwork in terms of contacts, programming, and we developed Project Voice. The prototype consisted of a digital health platform linked to through an iPad app that allowed patients to access educational content, social media content specific for PAD, and also track their activity outcomes using a tracking device like this one that allowed them to track their walking, supervised exercise therapy, as well as survey instruments that were specific for quality of life in PAD. And the idea around this project was that this platform could be customized for a research idea that an investigator might bring forward. By February of 2016, we had a site visit from Vascular Cures at Wake Forest, where I was at the time. In the following month, we enrolled our first patient. At this point, we've completed a pilot study of 20 patients, all of whom participated in Project Voice, have analyzed the data and submitted it in abstract form to a couple upcoming meetings. I think Voice will hopefully be a tool that can be accessed by researchers interested in building patient-reported outcomes or activity tracking or educational content into any research project they come up with, rather than having to start from scratch and build the thing from a blank slate. I can tell you that if I had tried to put something like Voice together without working with Vascular Cures and leveraging all the resources they had, it would have been impossible for me to do over several years, if ever, just working, within my own institution.